Good afternoon, Hattiesburg. Thank you for joining us for this briefing on Friday afternoon. We're going to walk through today's test numbers. We're also going to talk through the governor's most recent executive order. We will have another question and answer with Dr. Rouhbahksh from Forrest General Hattiesburg Clinic. We'll make a few notes for the weekend, and then, of course, our regular act of courage. Today's numbers, these are, as we always do, we let you know that these are system-wide numbers for all of our healthcare organizations. These are Forrest General's 19 counties, Merit Health Wesley's 18 counties, Hattiesburg Clinic, and Cimarron's several counties. So that's what you're going to see today. So the total numbers as of now, there have been 7,380 tests. I think it's important to know that the Hattiesburg area accounts for 15% of all the tests that have been done in Mississippi. Our healthcare community has really been out front on this. Out of those 7,380 tests, 867 have come back positive. Again, those are not all active cases, and they're not just in Forrest and Lamar counties. 6,084 have come back negative, and currently we have 428 pending tests. Our two goals in everything that we do over the past 2 months and going forward will be about protecting vulnerable populations. Those are people over the age of 60, people with underlying health conditions. We also endeavor to prevent overrun of our healthcare system by slowing the spread so that if and when you need healthcare for COVID-19, it'll be available to you. We look at two factors when we look at overrun of the healthcare system: hospitalizations for the Hattiesburg area. We have 33 people in the hospital. That's actually down slightly, which is a positive sign. Our 14-day average has been about 36.4, so to see that decline going into the weekend is a positive thing. We do have 4 patients in the hospital who are exhibiting symptoms, but we have not got their test results back yet. ICU admissions, this has been a tough week for that, and so we have 16 people in the ICU right now. That's above the 14-day average of 14.14. You can kind of see how these have gone. Hospitalizations have been trending upward, but to see this decline at the end of the week is certainly promising. ICU admissions, again, continue to stay between about the 14 and 19 mark, and so as we go forward, that's going to be a line that we really watch as we consider reopening things. Our totals per county, 294 in Forrest County, 141 in Lamar County. The total for the metro area is 435. And again, that's since this began in early March. That doesn't mean all those folks have COVID-19 right now. A lot of them have recovered. The number of active cases is obviously far less than that. However, one item of concern is our 5-day average for new positive tests. Again, these are new positive tests. The 5-day average, you take a day, you average it with the totals of positive tests the 2 days before and the 2 days after, and that's what you get. We're still seeing an upward trajectory in our curve. The orange line, Lamar County, the blue line is Forrest County, the gray line are the two counties combined for the entire metro area, and so we're seeing that number continue to climb to a point that we haven't seen thus far. There's really no way of getting around it. This has been a tough week for us. There have been 100 new positive cases in the metro area in the past week. Most of those are in Forrest County. We've met a new high in the 5-day average of new positive cases, which I just showed you. We saw our COVID positive ICU utilizations reach new heights this week. And of course, in the last 7 days, we've had 9 deaths. Most of those are also in Forrest County. With that said, we also heard today from the governor that he is going to extend the safer at home order for 2 more weeks. He encourages the vulnerable to shelter in place. We're going to really push that next week. No indoor gatherings of more than 10, no outdoor gatherings of more than 20. There are some reopening rules. Those are very stringent for salons, barbers, and gyms. And of course, all entertainment venues continue to be closed. This weekend, I know that we've already started receiving calls at the office about what is Hattiesburg going to do. We are going to continue working through our reopening plans for salons and barbershops and gyms and fitness centers. I will say that we've had some very good dialogue with gym and fitness center owners, as well as some salon owners and barbers. We hope to present a plan that's practical, that not only carries out what the governor stipulates, but also takes into account the spike in cases that we're seeing here in the Hattiesburg area. And so we're going to continue working through that. We hope to get you something sometime this weekend in regards to what our timeline is going to be. Of course, we were lucky yesterday to talk to Dr. Lamar Counties. We asked him a couple of questions, the second of which we'll go into right now, specifically asking about when we look at the long term. I mean, when does this end? And he talks about the need for not only a vaccine but also or therapeutic for us to move past this ultimately. And so I asked him that question yesterday, and here's his response. Can you tell us what's the status right now as we look toward a vaccine or a reliable treatment? Are we making any progress right now as a nation?
Absolutely making progress. And it should be noted that where we are at in terms of vaccine development is the fastest in the history of human existence. So that gives me a lot of personal hope because everybody, all the smart minds, all the scientists are focused on this entity. All their efforts are going to this, including those quasi-scientists like doctors like myself who are predominantly clinicians. We're doing some experiments and we're trying to do things. So that gives me a lot of hope. And the fact that we're on human trials at this point is breakneck speed. And some of that has to do with our technological advancements, our ability to get gene information about this virus and immediately start testing it. So that's unique in human existence. So that gives me hope. The other thing that gives me hope is also the intensity with which people are looking at a therapeutic, that is a medication or a treatment of some kind that could be a game changer. So whether it's the remdesivir medication you've heard a lot about, hydroxychloroquine and azithromycin that's now being actively studied and not so exciting as it once was. But there are many things out there that are being studied, including famotidine or Pepcid that you may have heard of, including hot and cold therapy, convalescent plasma serum. So we are making progress. And I know that personally because we are involved in trials locally. So we're getting information at a speed I've never before encountered in my career. So that gives me hope.
Do you think that we might have some of these ready to go in the next potentially 12 months? You think 18 months? What are you thinking?
So potentially a vaccine within 12 months, but there's a very, very big caveat there. So vaccines have different levels of efficacy, and we won't know the levels of efficacy for quite some time thereafter, meaning about a year or two after the vaccine's been on the market, we won't know how effective it will be. So if we get a vaccine today, like we could all have a vaccine available. There are many things that limit its usability. One is how much of it can we get and how expensive will it be? And then the third thing is how well will it work? And then the fourth thing is how safe will it be? So even if we got something available within 12 months, which is a possibility, we don't know how effective that particular vaccine will be. There may be multiple vaccines that come on the market. Likely the first one will be within about 12 months. Time will tell how effective it will be.
All right. Rouhbahksh, thanks so much. We look forward to visiting with you again soon. And we want to thank Dr. Rouhbahksh for taking time out of a very busy schedule to answer those questions. If you have a question for him or one of our other doctors or nurses who are on the front lines of this thing, we encourage you to reach out to us on social media or to email mayor@hattiesburgms.com, and we will ask him in a future segment about any kind of question on COVID-19. But what we learned from Dr. Rouhbahksh, what we learned from looking at our own numbers, is that we have to take this seriously. This is not over. We're seeing spikes in our own cases, and so the message of COVID-19 will be a threat until there is a vaccine or a treatment. And so if you are above 60, or if you have an underlying health condition, or are you around someone that has something, we have to continue engaging in good behaviors going forward. And that applies to Mother's Day because a lot of you, and I know I do, have mothers who are above 60, and so we encourage you to take care of your mother by keeping her at home. It's easy to want to go out to eat or bring her over to the house and interact with kids. I encourage you to be responsible, take care of her by keeping your mom at home. If you go visit, please wear a mask. Again, this disease can travel very quickly. Some non-COVID news that we're again excited to announce is another paving project. Today we began paving North Hill Drive in Ward 2, right off of West 7th Street. This should be completed, if not today, by Monday morning, and we will move on to the next project after that. And finally, our act of courage. Some anniversaries are good. Some other ones are really hard to remember and hard to process. And tomorrow is the 5-year anniversary from when 2 of our officers were gunned down in Hattiesburg in the line of duty. Benjamin Dino and Corey Tate were officers that I know that will always mean something to our department, will always mean something to our city. I know a lot of us remember exactly where we were when that happened. And when you think about the moments that have shaped Hattiesburg, this was one of those. And so to Corey's family and to Dean's family, to Robin and Walker, know that you are always part of our family and that our city will always love you and will always remember fondly your officer that meant so much to our city. So as we go into the Mother's Day weekend, remember to wash your hands, take care of yourself, wear a mask if you go out in public, do only what is essential, and remember that you're safer at home. And to all our moms out there, we wish you a very happy Mother's Day.